Dr. Robert Motzer, you just presented the results of the phase 3 Checkmate 914 trial evaluating nivolumab plus ipilimumab in the adjuvant setting of localized renal cell carcinoma. Can you first walk us through the study design and the result of the study?
So this was a trial that was conducted in patients with the common type of kidney cancer called clear cell kidney cancer, and the mainstay of treatment is surgical resection with an nephrectomy, where the tumor is removed as well as the kidney. We're able to identify to a certain extent those people that are at higher risk of relapse using a TNN staging system as well as the tumor grade. And so we identified patients that we thought were at a substantial risk of recurrence following nephrectomy with receiving no sort of adjuvant therapy. And those patients were screened on the trial, signed informed consent, and randomized to either a 6-month course of a combination immunotherapy with nivolumab plus ipilimumab versus matched placebo. Nivolumab plus ipilimumab is a very effective treatment in the setting of metastatic disease. It really revolutionized how we treat kidney cancer several years ago for people with very aggressive metastatic cancer. And so there was a lot of hope that when we took that very active, powerful regimen into this setting, we would essentially eliminate metastasis. However, the results were disappointing in that there did not appear to be a reduction in recurrence rates for patients with the nivo-ipi compared to the placebo. Why is that? It may have been tolerability of the program, since many of the patients did not complete the 6-month course. It could have been the fact that the course was too short. Many of the adjuvant courses have been a year. This was a shorter course of 6 months. Those could be factors that are involved here. There is a study that we're conducting that followed this that's looking at nivolumab monotherapy. And so I think that will give us a good sense in terms of whether it's a tolerability issue.
There were quite a lot of patients that exited the trial. Was that due to the toxicity of ipilimumab?
Yes. So for the patients that did not complete the 6 months, which was more than half, for the most part, they exited the study because of adverse event issues. Some of the patients relapsed within 6 months, or some patients just decided this was not for them, but many patients did develop adverse events and had to come off study.
We see that in other studies with adjuvant setting, the patients are more reluctant to having these kind of side effects. Do you see that as a problem for very potent immunotherapy?
Yes, I think that is an issue, and the experience that I've had in the kidney cancer setting was with the tyrosine kinase inhibitors, which really were developed 15 years or so ago, and there were 5 or 6 different trials with these tyrosine kinase inhibitors as adjuvant therapy. And what we found is that it was clear that patients do not tolerate side effects, or are not as accepting of side effects in the adjuvant setting as they are in the metastatic disease setting. And I think the reason for that is obvious. In the adjuvant setting, there may not be a development metastasis down the road. The patients are cancer-free, where if a person has active cancer, they're much more motivated to stay with the treatment regardless of the side effects. So that is likely a factor here, and I think that does need to be taken into consideration when you're developing adjuvant therapies.
Now you're moving into the second phase of the study with nivolumab monotherapy. What are your expectations here?
Well, I think it will help us to dissect out whether there's a tolerability issue here, or perhaps an issue with regard to duration of therapy. Since it's a better tolerated drug, monotherapy, compared to the combination, but on the other hand, it's still a 6-month course.
Dr. Motzer, thank you very much for being with us.
Oh, thank you for your interview and your interest in this area.
Yeah, thank you.